Okay, well, thank you for joining us. This is Kinstretch for Runners. I'm Steve Piper, and I'm here with Donna Jourdain. She's with Bush Babes Trail Running, and we're going to take you through a series of exercises that are geared more specifically to runners. So runners have a lot of tightness in their hips, their glutes, their hamstrings, all the way down to their toes. So we'll start at the hips today. You should have received the morning routine and always go through the morning routine prior to performing Kinstretch. It's a nice way to warm up. What you'll need today is a block and a tennis ball or lacrosse ball, some kind of squishy ball to some extent. But other than that, we're gonna start with Donna in a kneeling position. So Donna, come up into a lunge stance in this position. Here we'll start from the front of the hip. We're going to do linear motion first. So this is what runners are familiar with. Bring yourself into the end range by allowing your pelvis to come forward until you start to feel the stretch on the front of the right hip. So this is the stretch part. Here, Donna's just going to hold position before she starts to create the kinetic part, which is where she's going to amp up an isometric contraction with her back leg. So her back leg is touching the ground, and she will ramp up tension in her back leg by contracting, pushing down into the ground. She's been sitting there now for 20 to 30 seconds, so she's going to start a slow contraction. So Donna, start to push your back leg into the ground, and that should increase the intensity of the stretch. Ramp up tension, 20% effort, 40% effort, 60% effort, 80% effort, and that intensity in the hip flexor in the quad should be in 80% effort. She's going to take a deep breath in, squeeze all that air into your abdominals, push down as hard as you safely can, push. 3, 2, 1. That is the progressive side. She's going to let all of that tension go. Now she's going to take another breath in. She's going to lift her foot up towards her butt. Be careful not to have a hamstring cramp here. She's going to squeeze up for 10 without falling over. 9, point your toes. 8, 7, 6, 5, 4, 3, 2, 1. She's going to stay in position, relax back down. She should have more range in the pelvis now as she moves forward, putting the stretch back into the hip flexor and quadricep. If you can't see what's going on back here, just know that this is the regressive side, this is the progressive side. She brings her heel up to her butt. Start to push down again with the quadricep, shin pushing down into the ground, amping up tension again. 20% effort, 40% effort, 60%. Here's where the tension starts to get serious. 80% effort. And then the last one, she takes a deep breath in, pack that air into the core, push down as hard as you safely can, push, push. And then she's going to breathe out. And here, she's going to take another breath in, increase that tension again. She's going to lift her heel up to her butt, squeezing up, hold tension, fight through the tension. 3, 2, 1. Slowly relax back down. And now she's going to come forward onto her hands, with her hands inside of her feet. And so now she can focus on this front leg, squeezing in against her arm. So we've done the hip flexor on the front, and now we're going to do the adductor on the other side. So in this position, this leg is going to start to push tension against her arm. Her arm is blocking out the tension, so she's not allowing this to move. And again, she's been sitting here now for 20 to 30 seconds, so she's ready to start doing her progressive, which is the adductor. angular isometric contraction. So start to push in, 20% effort. When you're doing this, try to keep your back as neutral as you can, head up. That just allows more tension to be in your body. 40% effort, 60% effort, 80%. Here's where the tension gets serious. You're gonna fight through this tension. Take a deep breath, pack it down into the core, hold your breath as you push as hard as you safely can into your arm. Hold that tension, fight through that tension. You're fighting for hip space. And then breathe out, letting the tension go. Here is going to be the regressive side. As she leaves her arm here, she's going to take another deep breath in. Squeeze out to the side, squeeze and hold. You're squeezing through the external rotators. Hold that, fight through the tension. 3, 2, stay where you are. She's got this space now between her arm and her knee. She can move her arm out and block her hip even more, creating more space in the hip. So just relax there for a second, stay there. And then she's going to amp up another contraction. So second round, she's got more hip space. She's going to push into her arm with 20% effort, 40%. Another correction, just try to lean up if that's a thing. Lengthen out the spine, 60% effort. Here things start to shake a little bit. You get that neuromuscular firing, 80% effort. And then you take a deep breath in, squeeze as hard as you safely can, pushing into your arm. Push, hold the tension. Breathe out, letting everything go. You're staying in position. Take another breath in. Squeeze off to the regressive side. You can have less space here. Squeeze and hold. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Slowly relax back in. So what we'll do for the other side is we'll turn Donna sideways so that you can see from a side angle what's happening, but we're going to switch to the other side. So face towards this way, bringing your left leg behind you and your right leg in front. Good. So now move back a bit. Perfect. Yeah. Good. So remember that on this first series, you're trying to allow the pelvis to come into end range as far forward as you can get it. So bring your hips forward, point your toes, and you should feel that stretch portion come in at the first end range. First end range meaning this is as far as your tissue will currently allow, and as you work through 2 rounds of isometrics, you'll get more range out of your hip. And you're okay there?
Yeah.
So when she's ready, she's going to start to amp up tension, pushing her leg down into the ground. Very gentle contraction, 20% effort, 40% effort, 60%. At 60%, I shouldn't be allowed to lift this leg off the ground. Good. 80%. Take a deep breath in. Maximum safest effort, pushing down into the ground. Hold that tension. Push. Push. Breathe out. Let the tension go. Take another breath in. Squeeze your heel up to your butt, contracting the hamstring. Squeeze and hold. Hold. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Slowly relax back down. This is going to allow more space in your hip as you move forward. So a new end range position. And when she's ready, she's going to start her second round of progressive angular isometric contraction, pushing down 20%, 40%, 60%, always trying to get more space by fighting through that tension. 80%. Take a deep breath in. Push down as hard as you safely can. Push. Breathe out. Another breath in. She's going to squeeze her heel up to her butt as she contracts the regressive side. Squeeze and hold. 3, 2, 1. Slowly lower back down. Stay in position as now you bring your hands inside of your feet. Good. And again, the arm is going to block out the knee. And she has a little bit more hip space on this side, so she's actually going to start a little bit further out. So here you may need to bend your elbow, or if you've got plenty of range, you can always switch to putting your hand on the inside part of your knee. Go ahead, put your hand on there. And so now you've blocked out your hip because it might have more range on one side than the other. And so now that she's been in position for 20 to 30 seconds, she's ready to start her first round of isometric contractions. So she's going to push in this time, 20%, 40%, 60, 80, and here's your maximum safest effort. Breath in, pack that down into your core, squeeze everything in your body as you push your leg into your arm or your hand. Hold the tension. You're always fighting for more tension. Breathe out, holding space. Here, when you have your hand against your knee, you're going to keep your hand where it is. Peel your knee off your hand, pulling off to the side. Squeeze and hold. 10, 9, 8, 7, 6, 5, 4, 3, 2. Place your hand back on the inside part of your knee. Hold that end range space that you just worked so hard for. And then start to push again. Again, ramping up tension. Notice how I switch between a 10-second count and a 3-second count. Really, it just depends on what the joint space is giving you. 10 seconds if you have less tension. 3 seconds if you really have a lot of tension in there. Start to push in towards your hand, ramping up tension, 20%, 40%, 60%, 80%. Take a deep breath in. Squeeze in as hard as you safely can. Keep squeezing. Squeeze in. Maximum safest effort. Breathe out, letting all the tension go, but not losing that space that you just worked for. Take another breath in. On the second breath in, you're peeling away from center line, working the external part of the hip, the external rotators. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Slowly relax. You can come out of position slowly, and Donna's going to switch into what's called a butterfly seated position. So come and sit on your butt. You're going to sit with your feet in a butterfly position. Now, as many runners will note, this is a very difficult position to get in because you've got so much tension. So here's where the block is going to come in handy. So for Donna to have the most capability of creating tension in her external rotators, she's actually going to sit on this block. So go ahead and lift up. And you okay there?
Yeah.
You should notice that that takes some of the tension off the hips. So you're going to draw your feet in as far as you can. You're okay there? Mm-hmm. You're going to block out the inside part of the knee again, but this time you're going to do it with your hands. Your arms are going to, or sorry, you're going to do it with your arms. Your arms are going to be straight and stiff, so you're going to make fists. You're going to keep your head up, chest up, and you're going to pull through your hips until you find that end range space. So start to slowly creep forward with your torso. Good, pulling through. So you feel like you're at end range there in your hips?
Yeah.
Good.
Not very flexible.
That's okay. That's why you're here. And again, first 20 to 30 seconds, you're just letting the central nervous system adapt to the position you put it in. For many runners, this is going to be a challenging position. And then she's going to start to try to clamshell close her knees against her arms. Her arms are blocking out, so the arms create tension. She's going to do another round of isometrics by pushing up against her arms. So go ahead and start your tension. Again, ramping up slowly. You don't want to treat it like a light switch. You want to treat it like a dimmer switch, which is the cueing of 20% effort, 40% effort, 60%, real tension, 80%. Take a deep breath in. Squeeze as hard as you safely can, pushing in, push, push. Breathe out, holding space here. And now you're going to take another breath in. Go for the regressive side as you try to pull your knees off your arms down towards the ground, creating space. Again, you're after those external rotators of the hip. Squeeze and hold. 3, 2, don't lose position here. Bring your arms down to your new end range space. How you doing? You okay?
It's making me sweat.
Start to squeeze up again. Again, you're driving tension through the progressive side, which is the groin. Why are we working so much on the groin? Runners tend to have a lot of groin tightness, which can lead to knee pain, medial knee pain, if you let it get bad enough. 20% effort, 40% effort, 60% effort, 80%. Take that deep breath. Hold as much tension as you can. 100% safest effort. Breathe out. Take another breath in. Squeeze off your arms. If they don't move your arms, try to keep your arms where they are and squeeze down. Even if your knees don't leave your arms, just make them light. The important part is you're squeezing the lateral part of the hip. Squeeze and hold. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Bring your arms down, new end range. Just hang out there for a couple of seconds. And so that will do it for the adductors. We've done the hip flexors and quadriceps, hamstrings, adductors. The next thing we'll do is we'll just isolate the hamstrings. Again, with trail runners, any kind of runner I see, lots and lots of hamstring tensions. You come off the block and lay on your back. Good, put your feet flat, or sorry, your legs flat. So here we'll start with the right hamstring. Donna's gonna lift her leg up as far as she can, okay? Slight knee bend. We don't want this perfectly straight. That'll irritate the nerve back there, so slight knee bend. She's gonna come up with her hands. Both hands are gonna grab the back of the leg. So here the hands act as we've been doing with all of these angular isometric contractions. They've been creating a block. So with her hands here, and she's again going to sit here for 20 to 30 seconds, just accommodating to the position. Now she can start to ramp up another contraction, pushing her leg into her hands. Her hands are going to block out. So she's going to start ramping up again. Same idea, 20%, 40%, 60, 80%, Take that deep intra-abdominal breath. Maximum safest effort. And then she's going to breathe out, let all the tension go. Her hands are going to stay here. And here comes the kinetic part of the stretch. She's going to take a deep breath in. Her hands are going to stay here. She's going to draw her leg off her hands. More tension on the hip flexor and quad. Hold 10, 9, 8, 7, 6, 5, 4, 3. And she's not going to lose the space that she created. She might get a cramp. She can move her hands up and passively relax. She's got more. So you okay?
Oh, I got a cramp. I got a quad cramp.
If cramps happen, I've mentioned this before in the morning routine, if the cramping happens, come out of position, let the cramp subside, and then get right back into the position. So she's created more space in her hip so that she can create more tension on the hamstring. Okay? So round 2, she could go ahead and start her isometric contraction again, pushing. The really nice thing about ramping up through an isometric contraction is that if you are coming off an injury, extremely safe to ramp up through isometrics. So she's probably at about 40%. 60%, you can start to see a little bit of that shake coming in. 80%, take a deep breath. Push as hard as you safely can. Breathe out. She's going to leave her hands here. She might not get as much space this time. Take a deep breath in. So we're going to do the 3 count. So you're going to squeeze off her hands, holding that as long as you can. 3, 2, 1. Her hands create new space. She's getting new range because she's working on her hamstring. So you can slowly lower down. You okay?
Yeah.
Good. So you're going to switch up to the other side. The range is different on this side. You should be able to see that at home. One side does not have to be exactly the same as the other side. There's no need to be symmetrical. So first 20 to 30 seconds, she's simply going to sit at end range, what her current end range is, and then she's going to fight for more space, more hip space, more end range by working on the hamstring. So start to ramp up another contraction, pushing. And what you do at the foot here, if you're not getting a lot of tension in your hamstring, you could always just lengthen the hamstring by bringing the foot horizontal. 40% effort. 60% effort. 80% effort. Take that deep breath in. Push as hard as you safely can. Push. Breathe out, letting the tension go. Keeping your hands where they are. You're going to lift your leg using your hip flexor. Squeeze and hold. 3, 2, 1. Come down with your hands, new end range motion. So you're passively holding that there. And then you can start to ramp up your second round. Slowly ramping up tension on a nice smooth curve. 40% effort. 60% effort. 80% effort. Take that deep breath. Hold as much tension as you can. Push as hard as you safely can. Push. Breathe out. Let the tension go. She's going to leave her hands here. She's going to take another deep breath in. Squeeze the hip flexors as you draw in towards the chest. You're lengthening your hamstring. 3, 2, 1. Hands come down. Hold passively. And then you can relax back down. How's that?
Good.
Good. Okay, you can come up into a seated position. We'll switch to more of the knee now, so you can swing yourself towards the camera. And here, she's going to bring her left leg up into this position, and she's going to lock her hip by squeezing the back of her leg, just like we did in the morning routine. But here, this allows the knee to be the isolated factor, and all she's really going to do is bring her ankle up off the ground, squeezing in tight. Everything is holding in tight. And now from here, she's going to hold this as she starts to turn her whole tibia out to one side. And she's going to squeeze out that way. 3, 2, 1, before turning the whole tibia in. 3, 2, 1, out. 3, 2, 1, come back in. 3, 2, 1, out. And you can see as she's starting to fatigue, her ankle's starting to drop a little bit. You can always use the block as a way of maintaining that the fact that you're getting the knee joint movement and it's not coming from the ankle. The ankle will come next. Start to turn in. 3, 2, 1, out. 3, 2, 1, in. 3, 2, 1, out. Couple more. 3, 2, 1. And you should be able to see that the knee joint is moving. 3, 2, 1. Relax. You can switch up to the other side. Now again, if you're not happy sitting on the ground, you can sit on this block, which I don't think you need anymore.
No, I'm good. Look at how much farther my knee goes.
Right? So what you will see as you go through this is more range in your hip. All of the tight muscles that you're used to having from running should be nice and warm by now. Again, so she's going to block out her hip by squeezing the back of the leg. She draws up the ankle, and here the whole tibia is going to rotate in for a 3, 2, 1 hold. Turn out. 3, 2, 1 in. 3, 2, 1 out. This one I find particularly good. 3, 2, 1. For those of you who might have the arthritic knees, your knees need to have both flexion and extension and rotation. 3, 2, 1. You're lubricating the knee joint. 3, 2, 1. As she fatigues, we're just going to block out her foot with the block. So keep your foot off the block.
Oh, don't rest on.
Don't rest.
Okay.
3, 2, 1. Turn out. 3, 2, 1 in. 3, 2, 1 out. 3, 2, 1. And for me, there's no certain rep count. Turn in. What I'm looking for is she's starting to fatigue. She'll start to move her hip around a bit, or her foot will drop. That's when you know you're pretty much cooked. 3, 2, 1. Turn out. 3, 2, 1. So that's the knee joint. You can relax. And then we're going to bring Donna into what's called a combat stance, which is the position I've been sitting in this whole time. She's going to come up. If you can't sit in this position, then you can always come into a lunge or a half kneel position, whatever you think is best. So here is our combat stance. Donna's going to try to go and find the end range of her ankle joint by slowly moving forward. The key here is not to allow the body to shift sideways over the ankle. You want to stay on top of the ankle. And once she's found that end range, again, 20 to 30 seconds of accommodation period where you're just trying to settle into the end range joint space. You're okay there? Mm-hmm. And then she's going to start another isometric contraction where she's pushing her foot. So she's gas pedaling her foot down into the ground. ramping up tension. Again, dimmer switch, not a light switch. 20% effort, 40% effort, 60% effort, 80%. Take a deep breath. Push as hard as you safely can. And then she's going to stay there as she breathes out the tension. She's going to let all the tension go. The progressive side is the bottom of her foot. Now we want to go for the regressive side and create more joint space. She's going to try and lift her foot up to her shin, squeeze up, almost like you're going to slide a sheet of paper underneath the foot. Hold 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. She's going to relax back down. She's going to have more joint space. You can see how she gets more space out of that as she comes further forward. And she's going to start her second round of isometrics. Trying to always get more joint space by working on the muscle tissue, connective tissue surrounding the joint. Push down, probably at 40%, 60%, 80%. Again, you can always come into more of a tension position with your spine. Take a deep breath. Push down as hard as you safely can. Breathe out the tension. And then she's going to try, with this end range position, squeeze up to her shin. Squeeze up. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then relax. And then for the left side, so you can carefully come out of position, we'll just get Donna to turn this way so that you at home can see from the side. So bring this foot up into a combat stance. Good, so bring yourself forward, right? And then shift your body weight over top of your leg. Good. And you're okay there? Yeah. So you're going to measure the end range first. This heel is going to slightly pop off the ground. That's too far, so you're just going to back off until the heel just barely brushes the ground. And again, the block is useful. If you're really uncomfortable, you can always put the block under your hand to give yourself a little bit more space. And 20 to 30 seconds of accommodation. Donna's going to start her first round of isometrics on this side, pushing down 20%, 40%, 60%, 80%. Good. Deep breath in, hold tension, maximum effort. Everything in your body contracts as you push down as hard as you safely can. You breathe out, let the tension go. Take a second breath in. Try to squeeze the foot up to the shin. Squeeze and hold. 10, 9, 8, 7, 6, 5, 4, 3, 2. You're going to relax into more end range, which allows more space in your ankle. Here you can see she's coming a little bit more forward. You're probably fighting, in each one of these positions, you're probably fighting for 3, maybe 4 degrees of movement. And most people would say, well, so what? What's 3 degrees? Well, 3 degrees might prevent the next injury. If you have that joint space and the muscle tissue is used to working at a different joint space, then likely when you're running, they're going to be happier with the range that you do have when you're running. Start your second round here, 20%, 40%, 60%, 80%. Take a deep breath in. Maximum safest effort, pushing down, gas pedaling down into the ground, fight for space. Breathe out. Take a deep breath in. Try to squeeze the foot up to the shin. You're contracting muscle at end range. It shouldn't be easy. It's not easy, right?
No. Okay. Nope.
Breathe out and go get a little bit more joint space. Holding passively after the second round. And then slowly relax, come out of position. So we have worked on the muscle tissue that surrounds the hip joint. We've had some knee joint rotation and some angular isometrics in plantar flexion and dorsiflexion. The last part that we'll go to before we work on the toes, which is extremely important for runners, is isolated contracting. Now for this, you're going to use your tennis ball or your lacrosse ball. The key here is that you're using this ball as a feedback or a cueing approach to the glutes, which we know for runners is extremely important. And this cueing tool is going to allow you to focus on how to actually contract the glute without focusing on anything else. So Donna, we'll get you to lie on your side.
This way?
Yeah, sure, we'll do both sides. Okay. Your bottom leg is going to be straight out and your top leg is just going to work as a stabilizer, balancing you on the ground, okay? So now most runners that I know exactly where the glutes are because they've been told umpteen times to work on them. So this shouldn't be a problem for you, but just as a reminder, if you find the bony part of your pelvis and the bony part of the side part of your hip, if you just go sink in between there, you're pretty close to being on the stuff that is considered your glutes. So the ball is going to act as a cueing device. She's going to lift up and sink down onto the ball, and she'll know when she's in the right place because her facial expression will say it. And then she's going to come lay right down onto her shoulder. Unless that's not tolerable. If it's not tolerable, she can stay up on her elbow, but I have a feeling she's going to be able to tolerate laying on her side.
All the way down?
All the way down, yeah. Okay, and again, the nice part about having a block, if you want to support your head with the block, I think Donna's just fine with her arm. So again, the first 20 to 30 seconds, you really need an accommodation period for this iso. This is called iso ramping because the brain is not going to like that ball sitting in tender tissue. Okay, so the first contraction that she's going to do, she's going to follow the same protocol that we've been doing this whole class, which is ramping up like a dimmer switch, slow effort up to the maximum safest effort. The ball is sitting in her glute tissue. So to cue the glute, she's going to start to drive this whole leg down into the ground. She's going to gas pedal her leg down into the ground. And when you do that, you should feel tension where the ball is. It should feel like the muscle is contracting over top of the ball, which should alleviate in most cases a lot of that crappy pain that you're getting. Push down, ramping up, 20% effort, 40% effort, 60%. So here you're squeezing, you're trying to squish the ball into the ground. Bonus points if you break the ball. 80%. Take a deep breath in. Push as hard as you safely can. Breathe out, letting the tension go. The ball is going to sink deeper into the tissue. Here comes the most difficult part, is now she's going to take a deep breath in. She's going to try to lift this leg up, hinging at the ball. Hold, 3, 2, 1. Slowly relax back down. So the first round, you use the entire leg to cue the glute. And on the second round, because you've done such a good job of creating that contraction in the glute, on the second round, you really only need to focus on the tissue that's right above the ball. So now instead of thinking of driving the whole leg into the ground, you're only going to focus on the tissue that's just above the ball. Does that make sense?
Yeah.
So start your contraction again. Instead of pushing the entire leg in, just focus where the ball is. Ramp up tension, and it should be less painful on the second round. By pain, I just mean that the glutes are often quite sensitive in runners, so placing a ball with your body weight on top of them. If you start to get tingling down the side of your leg, you're probably sitting on a nerve. You want to move that ball. The second place you don't want the ball to be sitting is on bone. You won't achieve any results with tension on bone. So you should be at 60% effort, 80% effort. Take that deep breath, and you're only focusing on the tissue where the ball is this time. Maximum safest effort. Breathe out, letting the tension go. As the tension goes away, the ball sinks deeper into the tissue. And then you're going to try to take another breath in and hinge up with the leg, holding. So a little higher this time. 3, 2, 1. Relax. And then we'll get you to switch sides. And maybe what we'll do this time is have you face this way so that at home they can see a little bit more of what's going on the backside. Yeah. So turn this way, back to the camera.
Oh, back.
Yeah. And again, here is the hip bone, the lateral part of the pelvis, and then you've got the greater trochanter here. So here's two spots you don't want to set the ball. The ball is going to be just inside of that. She's going to straighten out the bottom leg. The top leg is going to act as a stabilizer. And once she's found that location, again, you can move this ball around anywhere you want on the soft tissue. She's going to come and lay down on her shoulder. And this won't be fair because you won't be able to see her facial expressions anymore. But you can see the ball here. Hopefully you can see that ball. She's going to start to drive her leg. Once she's got that accommodation period down, she's going to start to drive her leg down into the ground. And you can play around with how much load you have, how much body weight you have, by simply turning your hip over using your balance leg or your stabilizing leg. Push down 20%, 40%, 60%. You're driving the entire leg down into the ground. 80%. Take a deep breath in. Push down as hard as you safely can. Push. Breathe out. And then you're going to start to lift your leg up. Second breath in. Hold. Slowly relax back down. Give yourself a bit of a rest period. And again, on the second round, you won't need to drive the entire leg into the ground. You can isolate the tissue that you're working on that's directly above the ball. You can iso ramp up that muscle contraction exactly where the ball is. Start to ramp up, just squeezing the tissue where the ball is. 40% effort, 60% effort, 80%. Deep breath in. Always the same pattern of movement when we're dealing with isometrics. Push down as hard as you safely can. Breathe out. Second breath in. She's going to go mash tissue, lifting the leg up. Hold. 3, 2, 1.5. 1. Slowly relax back down. Okay, you can take the ball out of there, come into a seated position. So that is iso ramping. The next portion of Kinstretch for runners will actually work on the toes. To work on the toes, we'll start with the big toe, but we're going to switch to using a door. So you'll see a bit of a cut in the video, and then we'll switch to the door. All you need is a door. If you can't find a door, you can use the edge of a wall, but most people can find a door. Yeah. Okay, so the last part of Kinstretch for runners is to work on the toes. I couldn't emphasize how important it is to have toe extension in runners. When they run, oftentimes they're lacking toe extension, in which case they're running on either the inside part of their foot or the outside part of their foot. So here we're going to work on Donna's big toe extension and then her small toes. What you need for this is just the edge of a door. So we're going to bring this big toe up against the edge of the door. You're going to flatten out the rest of the foot. And again, with your isometrics, you just allow 20 to 30 seconds accommodation period just to be in position. And certainly if you're getting sharp pain, this isn't the exercise for you. You might feel some tenderness or stiffness in there. That's why you're doing this. So just like we did in the other segments, Donna's going to start to ramp up tension, pushing into the door frame, squeezing the big toe. And the nice part about using the door is that you can pull the door to center line or out to the lateral, depending on where you need most of the work. Take a deep breath, maximum safest effort. And then she's going to release the tension. Now without lifting the foot at all, she's going to try to squeeze the big toe off the door. Squeeze and hold. It might not even move off the door. Just the fact that you're squeezing, you can see this tendon popping off here. Hopefully not popping off, that would be bad. But you're squeezing as hard as you safely can. And then relax. That should give you a little bit more space to move closer to the door. So slide in closer. And then she's going to start to ramp up tension again. Maximum safest effort. When you do the maximum safest effort, you take that deep breath in, pack the breath down into your core, tension everything in your body, push as hard as you safely can. Breathing out, letting the tension go. And then she's going to try and lift the big toe off the door without moving her foot or other toes. Next to impossible in this position, but she's working hard for that space. And then she's going to slowly relax. Now, so take your foot off the door. That's the big toe. For the 4 small toes, she's actually going to turn and come with her 4 small toes on the front of the door, and the big toe will be down the side. So why don't you go ahead and turn. And I'll trade you positions. And so now her big toe is going to sit flat, while her other toes, you're going to have to hold the door from moving, good, are sitting up on the edge of the door. And for the left side, we'll do a side shot so you can see what's happening here. Go ahead and start to push into the door frame with your small toes. Again, ramping up the same idea. 60%, 80%, maximum safest effort. You tension the entire body, push as hard as you safely can. And then you let the tension go. Try to lift the small toes off the door, squeezing. And you can see it's working just by the nice, beautiful blood flow that Donna has in her foot. And then relax. You can bring your toes a little bit further up the door frame, slide down. Now you can see your big toes a little bit closer to the edge of the door frame here. So hold the door there. Ramping up tension. Maximum safest effort. Push. Breathing out. Try to squeeze off the door. Hold. And then slowly relax. So for her left side, we'll just change the camera angle so that you can see what's going on. So we have switched over to the left foot. Here you're going to get a different camera angle so you can see what's going on. Hopefully you can see this big toe, and a lot of people have this bunion here. This is what I was talking about in terms of moving the big toe along with the door. And you can angle that so that your toe is more straight up and down rather than being, usually with bunions, they point way off to the side. So Donna's going to start her first isometric contraction on her left big toe, ramping up tension. Maximum safest effort. That was a little quick. Push as hard as you can. You can see all the blood leaving her big toe. As she squeezes it into the door frame, breathe out. Take another breath in, try to lift up. Hold that. 3, 2, 1, relax. You can bring your foot in a little bit closer to the door frame. And again, you want to line this up where you're challenging the toe to be straight up and down. And so she's ready to go into her second round. 20% effort, 40%, 60, 80. Deep breath. Hold tension as you push. Breathe out. Toe's not going to move off the door frame. She's going to try to squeeze as much as she can out of it. 3, 2, 1. You can bring your foot off the door frame and then turn around so that your left small toes are on the front part of the door. And here is the camera angle that we were talking about. Now you can see her small toes are pushed up against the door. The big toe is flat. And you want to hang on to the door so that your toes don't push it away. Bonus points if you bring the door off its hinges. Start to push into the door. I gotta work on my jokes. 20%, 40%, 60, 80. Take a deep breath. Push as hard as you safely can. Breathe out. And then you're trying to squeeze the small toes up to the knee. Squeeze and hold. Slowly relax. Again, you can bring your toes in a little closer to the wall. A little bit more toe extension. Let this big guy chill out. And then start your ramping procedure again. 60% effort, 80% effort, deep breath, maximum safest effort. Notice we always use the same type of isometric contraction, ramping up, hold. Breathe out. The progressive side is here. The regressive side is the back side of her toes. You're going to try to squeeze that regressive side without moving the foot. Hold, 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 and then you can slowly bring your foot off the door. So then you should notice a big difference in how much your toes can actually extend when you run. And so that concludes Kinstretch for runners. We worked a lot on the connective tissue surrounding the hips. We did some knee rotation. We worked on ankle plantar flexion and dorsiflexion, and then last but not least, working on the toe extension. Don't forget about the iso ramping techniques for the tight tissues in your glutes. You can apply that to any tissue really, but the glutes I find for runners are key. Anything you would like to add, Donna? How was that?
Oh, it was really good. It makes your hips feel, I can't believe how much more motion I got stretch in my hip.
Right, and for runners, that's probably one of the biggest keys is you need more space, more end range, so that when you are running, you have an easier time moving through. That concludes Kinstretch for runners. Thank you.